Hey everyone, my name is Emaan Chaudry.
And my name is Danielle Solish. And today you're listening to the 14th episode of Seeing Clearly, a pre-clerkship guide to all things ophthalmology. On today's episode, we are going to be interviewing Dr. Yasser Khan.
So Dr. Yasser Khan is an internationally renowned ophthalmic surgeon, humanitarian, and entrepreneur. He is an oculo-facial plastic, reconstructive, and orbital surgeon residing in the Greater Toronto area. He is an associate professor of surgery at McMaster University and the University of Toronto. He teaches cutting-edge and innovative surgical techniques to surgeons nationally and globally. His international fellowship in oculoplastic and orbital surgery has trained over 20 surgeons worldwide. He is also the founder, owner, and director of Carrot Surgery Clinics, which combine information technology and medicine to provide state-of-the-art healthcare options for clients and patients.
Dr. Khan is devoted to national and global humanitarian medical work. He's the founder and CEO of GIVE, the Global Initiative for Vision and Eye Care. GIVE's primary aim is to develop social entrepreneurship solutions to empower local populations and treat blindness. He has worked in this capacity in over 40 different countries and in Northern Ontario with Indigenous communities. And so without further ado, we would love to introduce Dr. Khan.
Hi, guys. Nice to be here.
It's great to have you as well. So now that we've given our nice introduction, we are going to begin with our first question. So Dr. Khan, would you mind just telling us what drew you to the field of ophthalmology and more specifically oculoplastics?
Well, Danielle, that's a pretty loaded question. I mean, after 20 years, that answer to that question has changed basically every 5 years as to why I became an ophthalmologist and why I wanted to become an ophthalmologist. And it's never any clear. There's 100 reasons now why I want to be an ophthalmologist. One thing I'm clear of for sure is that if I was to do it all over again, I would still be an ophthalmologist and I would still be an oculoplastic surgeon. So I'm sure of that 100%, which I think is a good thing. I may do things a little bit differently, in how I practice and how I live life and how I live my professional life, but I would still be that. You know, like many of us, I mean, I guess a standard medical school interview question, isn't it? Is that, I liked surgery from day one. I went to McMaster from a medical school, and we all linked up with a family doctor our first day of medical school. I didn't. I linked up with a general surgeon, and because I wanted to be a surgeon, period, from before I got in. And sometimes you know early on whether you're more medically inclined or surgically inclined, and so then it was a matter of picking the surgical specialty that was right for me. And it wasn't general surgery. Standing up for 5 hours straight and going through bowels and bowels just was not my cup of tea. So I really got interested in ENT and did a lot of research in ENT, head and neck surgery at Sunnybrook and other places. And next door to me was while I was doing an ENT elective, next door to me was an eye clinic at Sunnybrook Hospital at that point in time, and I knew nothing about eyes. And so, the eyes are so lit. I probably ought to know something about eyes, and our program was very, very poor. So I went across, and there was a resident there who's since graduated and moved on, and I said, listen, can I just spend a week of my holiday time just learning more about eyes? So I did. And the rest is history. I realized just how diverse and how amazing ophthalmology was. And I found that over the years, a lot of people who are interested in ophthalmology, I think that's why I always encourage an elective. When they do an elective, that's when they realize, how diverse the eye itself is and the anatomy and looking at an eye through a slit lamp. The first time you do it, it's euphoric. It's like an amazing experience. At least it was for me. When I saw an eye, the cornea, the iris with a slit lamp, it was just an amazing feeling. And then when I saw my first cataract surgical procedure, 10,000 procedures later, I'm still just as enthusiastic, although sometimes I do forget and have to remind myself. So then I just went and I did the whole ophthalmology route, and trying to get in and whatnot. But it was that one aspect that convinced me, and I find that that's what happens to a lot of medical students when they see ophthalmology. Many of them, I probably say about 80%, decide to do ophthalmology when they're exposed to ophthalmology. I think it's the number one thing in medical schools. Most of us are not exposed to ophthalmology enough. Yeah, and then fellowship-wise, I was always very surgically inclined. So I picked one of the more surgical specialties in ophthalmology, which is oculoplastic surgery. And also because I was interested in ENT, oculoplastic surgery is kind of halfway between ophthalmology and ENT and plastic surgery. So it incorporates a lot. The fellowship actually was titled Ophthalmic, Plastic, and Reconstructive and Orbital Surgery.
Mhm.
So yeah, that's the long-winded answer.
Well, thanks for sharing the long-winded answer. For us, you're actually our first oculoplastic surgeon guest. So it's really nice to have our listeners, listen to that story, because during COVID, we haven't really been able to have electives. And so it's nice to hear your experience and how much of a difference that one elective can make. So thank you for sharing that. Kind of along the lines of oculoplastics, do you mind speaking a bit about your day-to-day, maybe the bread and butter of oculoplastics, just for our listeners that don't really know much about it?
So oculoplastic is a very diverse subspecialty ophthalmology. It interacts with plastic surgery, dermatology, as well as otolaryngology, and even some neurosurgery as well, and orthopedics, and craniofacial surgery. It's got all that in. So it's basically a surgery of the eyelids, of the tear duct, which is in the nose, and the orbit, which is which just surrounds the eyeball, and that includes anywhere from cosmetic. So cosmetic eyelid surgery like blepharoplasty, upper and lower lid surgery, even facelifts and other cosmetic things like Botox and fillers. I mean, all of us do that, mid-face lifts. But basically, it's this area of the face is where we specialize in, both, outside and inside, but outside externally. The orbital includes orbital fractures. So we do a lot of facial fractures, zygomas, floor fractures, medial wall fractures. We do that. And orbital tumors, of course, cysts, infections. We also fix the tear ducts. In kids, we do a lot of probing and irrigation where, kids are born with blocked tear ducts, and we, kind of probe them and open the tear ducts. We also do tear duct reconstruction where we work in the nose to make a new tear duct opening, or a dacrocystorhinostom as it's called. So I do mine endonasally or endoscopically. So I'm working in the nose using the endoscope, very similar to what the ENT surgeons do with their FES, their functional endoscopic sinus surgery. And and I mean, sometimes we work with plastic surgeons. We do lots of skin cancer, lots of eyelid cancer with flaps and grafts. And, we often work with plastic surgeons. We work with ENT. For cancer, for example, we also, sometimes I'll work with an ENT to do a septoplasty, and I'll go in and do the tear duct reconstruction itself. And of course, with neurosurgery, there's some tumors at the apex that you can only get through a craniotomy by lifting the brain up, which I don't do, the neurosurgeon does, and going in there and removing an apical tumor at the orbital apex. So it's very diverse and keeps it interesting. Most oculoplastic surgeons nowadays stop doing general ophthalmology and do solely oculoplastics, orbit, and eyelid surgery. A few of us, like myself, have never given up some aspects of other surgery. Like I still do cataracts and pterygiums because I enjoy doing them, and I'm comfortable and good at that, so I still do it. But I also do a comprehensive oculoplastic practice. But most of us, I think, as time goes on, many oculoplastic surgeons across North America just focus in on oculoplastics.
It's awesome. It seems like there's such a large variety, and also it's really nice to hear all the different connections and relationships you have with all the different specialties, because I think there's often this conception that ophthalmologists only really work with ophthalmologists, and clearly that's not even remotely the case. So
I mean, we even interact with oral surgeons. I mean, we do hard palate grafts, we do ear cartilage grafts. So we've even worked with some oral surgeons, although now I harvest my own hard palate grafts. So it's very diverse. Yeah.
Oh, that's awesome. Thank you for sharing that. Switching gears just a tiny bit, I was wondering if you would mind speaking a little bit about the international side of ophthalmology and the exposures and experiences you've had there, such as being able to travel to practice in medicine, the educational experiences with other academic institutions all over the world.
Yeah, international ophthalmology has been great. I mean, in the end, I always tell students that that, there's one thing. I mean, if you look at why are you even doing medicine and ophthalmology and oculoplastics and whatever, is to make an impact on your patients, make an impact on your community, and make an impact on the world. I mean, as time goes on with technology, the world gets smaller and smaller. And that's why one of the reasons why I decided to pursue a master's in digital transformation and innovation was just to kind of link my interest in technology and where it's going with how the world is being digitally transformed. So what I mean by that is that that's made the world a lot smaller, right? And there's lots, and especially with COVID now and all the Zoom conferences and Zoom meetings and interactions, it was actually easier to meet people on Zoom than actually fly out. So that's brought the world even more together, in my opinion. And so I started international ophthalmology. Oh gosh, I mean, I think I started about 15 years ago or 16 years ago. I've always had a passion for travel. I've always traveled a lot, even when I was growing up, because of my father's job and things like that. So I've always had a passion for making an impact, because traveling is for many reasons, not just for for helping and making a difference, but it's also for yourself as well. It's an adventure, and it makes your career and your life interesting, because what happens is that then when you come back to Canada, for example, or your home, wherever that may be, then you're more appreciative of what you have at home and your patients. Plus, one thing I've realized is that, a lot of us in North America and Canada are very Canada-centric. Like, there's a whole world out there. There's a whole world where there's some really interesting stuff going on with regards to ophthalmology surgery. I've learned from every single mission that I've done. I've learned from medical students, I've learned from residents, I've learned from fellows. I've also learned from my international interactions, new techniques of doing things. You learn that people, if you go to Ethiopia or Uganda, people learn to do things and get it done, using things that we would never dream of using here. So really exposes you and makes you into a better person, which is most important, better physician, better surgeon. And my first trip, where was my first trip? Gosh, I think my first trip was to Vietnam, way back in, 2006 or 2007. And I haven't looked back ever since. So I've been to about over 40 different countries now, have both as an academic, professor and lectured, but also taught surgery, done surgery and things like that. Yeah. So it's been just memorable, and it's been a highlight. I before COVID, I used to travel every 3 months, basically. It got to a point where I couldn't stay here for more than 3 months. I had to travel to either lecture or do surgery or teach surgery. COVID kind of stopped me or slowed me down a little bit, but hopefully that will resume again shortly.
Do you have any trips planned in the near future?
Lots of talk. People have always been calling me, and even during COVID, because as you know, I mean, some countries had different levels of lockdown and restrictions. I mean, I think Canada was one of the more restrictive countries in the world.
Yeah.
I think we were as restrictive as Kyrgyzstan and India and Kazakhstan. I think definitely out of the Western nations, we have more restrictive. A lot of the other countries have been a bit more open with travel policies. And obviously, as long as you're vaccinated and you have your PCR testing and all that stuff, right? So that's kind of restricted me. But I think anywhere. I mean, I don't know where. Probably somewhere in Africa. Because Africa, I mean, I've meant to do a lot of missions in Africa for a long time, and they've been waiting and calling me and whatnot. So probably somewhere in Africa. I've got some ideas as to where, but yeah.
That's awesome. Well, thank you for sharing that. I feel like as med students, especially in Canadian institutions, we're kind of focused on what we do in the hospitals here and forget that there is, a world outside Canada, like you said, and there is opportunities to practice outside of Canada, outside of North America. So it's really, really excellent for our learners to hear that. So thank you for sharing that. And kind of on the side of our learners, we know that you work with a lot of students, residents, fellows. Do you have any tips for our learners that are listening to the podcast? Maybe like what makes a good learner and how students can improve the way that they learn?
I'll learn in what sense?
Like any medical students or residents looking either to pursue ophthalmology or just any specialty in general, just what you've learned from the teaching point of view.
The thing is, everybody's really smart. I think when you go to university, and especially when you go into medical school and are in medical school, I think that it's a level of achievement that everybody should be proud of. You know, one again, I think one thing that I've learned is I'm a believer in one thing. I mean, you know, whether it's in your personal life, in your family life, in your relationship, in medical school, in your career, in your job. I mean, pick that one thing, such that if you do this one thing, everything else will be easier or unnecessary. Okay, so you know, pick that one thing that inspires you. I think you know, prioritize that, and you know, that one thing really basically is your purpose, right? I mean, what is your purpose? I think that a lot of us don't ask at any level. Is what is your purpose? You know, what is your purpose of being in medical school? And you know, I mean, I never asked myself that, and now I'm looking back 20 years later. I mean, even I never asked myself, why to become an ophthalmologist. Yeah, I you know, between you and I set a standard line to the admissions committee, sure, but did I really understand why I wanted to be an ophthalmologist? No, only now do I understand properly as to why I became an eye surgeon. And you know, and so knowing your purpose early on, I think it will really help you become better. And one thing that really helped me early on is journaling, right? And I didn't do it enough until the last 5 years, where I journal almost every day. I journal, and even if it's like I put a timer on for 7 minutes, even if it's like 7 minutes of writing, just whatever comes to your mind, just write it. And I think as technology advances, and most of us, okay, well, say, you know what, we don't have to write, we can just do our smartphone, and we keep our calendars, everything on our smartphone. And not to sound old-fashioned, but there's a lot of psychology and research behind putting a pen, using your hand to write your thoughts down, and you know, make notes. I mean, you just have to search the literature, and there's a lot of research of how that is important in stress relief, in retention, in goal producing, and purpose, in so many areas, right? And so I mean, I used to buy these moleskin journals, and I've got a ton of them now, and I would just write, even if it's rubbish, right, for about 7 minutes and whatever longer. That's one thing. The other thing that I always tell you know, undergrad, even medical students wanting ophthalmology, this is a long road, guys. Medicine is a long road. If you're in engineering or tech, you'd be out by now, working and doing very well. So there has to be more reasons than financial for you to do this. It's a long road. You'll probably be in your early 30s, and so you're giving up the prime of your youth in medicine. Medicine gives you a lot, but also takes a lot from you. And anybody who has peers and family and parents or friends in medicine can ask them, and they'll probably say to them, it gives you a lot. It's a blessed life. It gives you respect, gives you opportunity, gives you the ability to do so much good for so many people, right? But also takes a lot of personal toll on you, professional toll, personal toll. So the thing that I realize now is to look at, and that's what I tell a lot of medical students, is to look at where you are as a job. Okay, so right now, my role in life right now at this present moment in 2022, January, whatever it is, 23rd, is to be an ophthalmologist, right? That's my current job. And yes, I may make more than you and you know, both you guys, right? For example, as an ophthalmologist, but that's my job right now. When I was in medical school, my job was to be a medical student, and that's it. It's a full-time job. You guys work the same hours as I do. Even when you're a resident, when you're a fellow, when you're doing your PhD or your master's, whatever, that's your job, right? The key thing I found with that is that then, you know what? Then you don't stop living your life. A lot of people leave everything for the end. You know, when I graduate medical school, I'll do this. When I become an ophthalmologist, I'll do this. When I become an oculoplastic surgeon, I'll do this. When I have my own office, I'll do this. And I went through all that. And when you realize, and when you actually get there, you go, oh, okay, what do I do now? Right? So you've left all that life behind. So the advice I would give a lot of people now starting off early on is live every day, every year. Just have the mindset that this is your job. Okay, that's what you're doing. Your job right now is to be a medical student, and enjoy life. I mean, have within reason, have the experiences you want to have the relationships, have the life experiences, discover, explore. whatever time permitting. I mean, I have my time restrictions just as you do. I can't leave my patients. I'm on call. I have OR. My freedoms are not, are restricted as well. For example, I mean, I'm not comparing, it's apples and oranges, but the point being is don't stop living your life. And that's the advice that I'd give is that you know what your position is and know that it's a job. It's your role right now at this present moment. Yeah. So live life.
Well, that was very motivational and inspirational, honestly, though, because sometimes it's easy to get lost, especially in the long track and the long road. And so it's really nice to always come back to that thought. So thank you. And with all of that, we kind of wrap up all of the ophthalmology type questions that we have for you today. So we're going to move to our favorite segment, maybe our listeners' favorite segment, which is our Would You Rather, just to get to know you a little bit more on a personal level. So I'm going to start with one question, then Emaan will have one after. But my question for you is, would you rather live in a world where you dance instead of walk, or where you sing instead of talk?
I would, well, I mean, I can't sing or dance. So, I mean, you guys really, but who cares? I would rather live in so it's sing or dance. I'd rather live in a world where I would dance.
Okay. That's
Fair enough. This one might be a bit easier for you, just knowing some of your hobbies, but would you rather hike to a mountain peak or a deep dive to a sunken ship?
I would rather go a mountain peak. There's nothing like going up above the clouds, guys. That, I mean, if you don't come into contact with your existence and your reason for living, going up to a mountaintop where there's nothing, there's not a single living thing. There's just ice, clouds and sky, and that's it. And you, and if you don't find existence or whatever at that point in time, then it's hopeless. Yeah. So yeah, I'd rather climb a mountain.
Expected that one.
Honestly, I think I would say the same as well.
Yeah.
Well, with all of that, I think that wraps up today's episode. So I'm just going to close off by, first of all, thank you so much, Dr. Khan, for joining us. And then thank you all to our listeners to listening to this episode of Seeing Clearly, which is our pre-clerkship guide to all things ophthalmology. You can stay caught up with us and everything else iCurriculum related by checking out our website at www.icurriculum.com or follow us on Instagram at iCurriculum. So thank you so much, everyone. Thank you, Dr. Khan.
Great job, guys. I think this podcast is an excellent idea, and kudos to both of you. I mean, honestly, you guys should be congratulated for coming up with this. It's a fantastic thing. I think it gives a platform to a lot of people who have a lot of really good things to share.
Thank you. And thanks for being with us today.
Anytime.
So much.